Good day everyone, my name is Irish Maybe Malagutnot from BSN 1A Johnson, and today I will be reporting all about ankylostomiasis. But before doing so, I will be doing a small icebreaker. Here are the subtopics that we will encounter today. We will encounter the causative agent of ankylostomiasis, its mode of transmission, pathogenesis and clinical manifestations, laboratory diagnosis, treatment, and prevention. But first, what is ankylostomiasis? Ankylostomiasis is also known as the hookworm disease. It is a parasitic infection caused by Ancylostoma duodenale and Necator americanus. These parasitic worms primarily infect the small intestine of the humans. Sila po ay nanatili sa ating small intestine. Children who frequently have hookworm infections can experience a slow growth of mental development. Ito po ay dahil sila ay nagkakaroon ng loss of iron and protein. Hookworm was once widespread in the United States. The Centers for Disease Control estimated that 576 to 740 million people in the world are infected with hookworm. It mostly affects people in developing countries in tropics and subtropics due to poor sanitation and hygiene. Most people infected with hookworms have no symptoms or are asymptomatic. And now we will proceed with the causative agent. As I mentioned earlier, there are two species of hookworm that predominantly infect humans. These are the Necator americanus, also known as the New World hookworm, and the Ancylostoma duodenale, also known as the Old World hookworm. So here are some pictures of the two species of hookworm para mas ma-visualize natin yung kanilang difference. So both of them are called hookworms because they have a hook-like structure. So gumawa ako ng table para makita natin yung differences ng Ancylostoma duodenale at ng Necator americanus. So yung size ng Ancylostoma duodenale is larger, meanwhile ang size naman ng Necator americanus is smaller. Ang shape naman ng Ancylostoma duodenale is in a single curve that looks like a letter C, meanwhile ang Necator americanus naman ay mayroong double curve na nagmumukhang letter S. So kung nakita ninyo yung picture na shinare ko kanina, ang Ancylostoma duodenale ay mayroong two pairs of ventral teeth sa kanyang mouth. Meanwhile, ang mouth naman ng Necator americanus ay mayroong one pair of ventral cutting plates. So, ang location naman ng Ancylostoma duodenale ay siya ay more prevalent in Africa, Asia, and in the Middle East. Meanwhile, ang Necator americanus naman, hence the name, is more common in America and Australia. So, for the eggs naman, the Ancylostoma duodenale lays more eggs per day, meanwhile ang Necator americanus naman lays fewer eggs per day. So additional information na lang din, ang Ancylostoma duodenale is commonly found in the regions with cooler climates, meanwhile ang Necator americanus naman is commonly found in warmer, more humid regions. So let's proceed with the mode of transmission. So, transmission occurs via fecal dermal route. A person can be infected by walking barefoot. So, kapag tayo ay naglalakad, tapos wala tayong shoes or cover sa ating mga paa, tapos tayo ay tumapak sa feces na merong or infected ng filariform larvae ng Ancylostoma duodenale or ng Necator americanus, so maaari siyang mag-penetrate sa ating skin, causing it to travel to our bloodstream. So a person can be also infected by sitting in contaminated soil. So, ganun din ang mangyayari. Pwede rin siyang mag-penetrate sa ating skin. A person can be infected by ingesting soil particles that have been contaminated with their larvae. So, kapag ang isang tao ay naka-ingest ng soil particles na contaminated na ng kanilang larvae, maaaring dumiretso ito sa kanilang small intestine or sa kanilang intestine kung saan sila ay magmamature into adult hookworms. A person can also be infected through our pet's stool if they have an infection. Let's proceed with the pathogenesis. The pathogenesis of Ankylostomiasis, also known as the hookworm disease, involves a complex life cycle of the parasite and its impact on the human body. So first, skin penetration. So kapag yung individual ay infected siya, so siya ay magre-release ng eggs ng hookworm sa kanilang feces. Tapos sa warm moist soil ay doon mag-hatch yung eggs into a larvae. Tapos yung larvae na yon is magpe-penetrate sa skin ng isang individual na nag-walk barefoot or kaya naman is nagkaroon ng contact sa soil. And then, nagkakaroon ng larval migration. So, kapag nakapenetrate na siya sa ating skin, yung larvae ay mag-enter sa ating bloodstream. Tapos mag-travel siya sa ating circulatory system. Tapos mag-migrate siya sa ating lungs through the heart at saka sa ating right ventricle. So, meron din ditong pulmonary involvement. So, in the lungs, nag-mature yung larvae. Tapos, nai-irritate niya yung lung tissue. So, kapag na-irritate yung ating lung tissue, ito ay nagkakos ng coughing, ng wheezing, at saka ng shortness of breath. So, nagkakaroon din ng ascension and swallowing. So, kapag 'di ba, sinabi ko na nai-irritate nga ng larvae yung lung tissue at nagkukos siya ng coughing. Yung larvae, maka-cough up siya and then siya ay masuswallow. Next is nagkakaroon ng intestinal establishment. So, di ba na-swallow na yung larvae? Siya ay mag-travel sa ating small intestine, tapos dun siya mature into adult hookworms. Tapos yung adult hookworms naman na yun is mag-attach sa intestinal wall gamit ang kanilang mouth parts, which is yung na-mention ko kanina na ventral cutting plates at ventral teeth. Next is nagkakaroon ng blood loss and tissue damage. The hookworms feed on by blood by sucking or actively biting the intestinal lining. Ito ay nag-cause ng chronic blood loss na nag-lead sa iron deficiency anemia, nag-cause ng fatigue, weakness at saka ng pale skin. Ang attachment at feeding ng hookworms ay nakaka-damage sa ating intestinal wall, kaya naman ito ay nag-lead sa inflammation at saka sa discomfort. Lastly, egg production and fecal excretion. So, yung adult hookworm, siya ay nag-reproduce sa ating intestines. Siya ay nag-lay ng eggs tapos marirelease sa ating feces. Tapos yung eggs na yon is mag-leave sa ating body through defecation at maaaring makontaminate ang soil na maaaring makapag-start na naman ng panibagong cycle. I will provide a summary of the life cycle of the intestinal hookworms. First, the eggs is released in feces, and then it will be hatched into a rhabditiform larva, and then it will be developed into a filariform larva, and this filariform larva will penetrate the skin and travel into the bloodstream, into the lungs, and then they will be cupped up and swallowed. And then they will be in the small intestine where they mature into adult hookworms, and then they will attach into the intestinal walls and feed, and then they will lay eggs and multiply and release their eggs in the feces, and then the eggs is released again in defecation. So there is another species of hookworm which is called Ancylostoma ceylanicum. Next, we have the clinical manifestations. People that are infected by Ancylostomiosis is mostly asymptomatic. So, ground itch can also occur. So, what is ground itch? It is a disease of the skin of the feet. It is caused by the penetration of the hookworm larvae, characterized by a blister-like eruption and itching. So, ayan siya, kagaya ng nasa picture. Yan yung ground itch. People infected with hookworm infection can show some of the following symptoms. First, abdominal pain, nausea, fever, itchy rash, loss of appetite, weight loss, diarrhea, extreme tiredness and weakness, anemia, heart failure, blood in stool, and in pregnant women, the fetus may not grow properly. Now for the laboratory diagnosis. To make a proper diagnosis of hookworm infection, your healthcare provider may request certain examinations, including a microscopic examination of the stool to check for hookworm eggs. So, basically, ang ginagawa dito is kumukuha sila ng stool sample, then nagkakaroon ng microscopy or ng microscopic examination. Tapos binibilang doon yung number of eggs at saka yung shape ng eggs. Another is taking blood samples to check for the presence of anemia or a lack of certain nutrients. So, dito naman ay blood samples ang kinukuha para ma-reveal kung merong anemia o wala ang isang individual or para makita rin if meron bang severity na yung anemia ng isang individual. Next is the treatment. Some certain medications are used in treating hookworm infection, usually administered for 1 to 3 days. Hookworm infection is treated with albendazole, mebendazole, or parental pamoate. Dosage is the same for children as for adults. Albendazole should be taken with food. In this table, we have the drugs as well as the dosage for adults and children. For the first drug, which is albendazole, 400 milligrams orally once, mebendazole, 100 milligrams orally twice a day for 3 days, or 500 milligrams orally once. Parental pamoate, 11 milligrams per kilograms up to a maximum of 1 gram orally daily for 3 days. Albendazole and mebendazole may be given for treatment. Iron supplements may be given for people with secondary anemia. And lastly, for the prevention. First, we must practice good hygiene, which includes proper hand washing to avoid ingesting soil particles that are contaminated with a hookworm egg or a hookworm larvae. Then we must avoid walking barefoot and we should always wear shoes so that we can avoid having a hookworm infection. We should always do the proper disposal of human feces and we must not defecate outdoors. That is all for Ankylostomiasis. I hope you learned something. Thank you for listening. Now let's proceed with the assessment. So there are 10 items in my assessment and here are the questions. Number 1, it is also known as the hookworm disease. Number 2, what are the two species of hookworm that are predominantly infecting humans? Number 3, it infects the blood of the humans. Number 4 to 5, give two modes of transmission. Number 6, give at least two differences of Ancylostoma duodenale and Decatur americanus. Number 7, give one symptom of ancylostomiosis. And number 8 to 10, list all of the drugs that is used to treat hookworm infection.